We begin, though, with the push to prevent COVID outbreaks in classrooms as schools across the country prepare to welcome students back.
Health experts are warning of a perfect storm. Schools reopening without masks while the highly contagious Delta variant spreads. Now, an NBC News exclusive details on the Biden administration's push to vaccinate as many kids as possible in the coming weeks. We have a team of correspondents lined up to cover it all. NBC's Heidi Presbella is outside the Department of Education. Katie Beck is in Atlanta for the first day of school there. Heidi, we want to start with you. As we've been discussing, a lot of school-age kids are too young to get vaccinated. Others are old enough, but they just haven't gotten the shot yet. Tell us about your reporting. How is the Biden administration hoping to target those who are eligible?
Yeah, Joe, a series of new back-to-school initiatives being rolled out today. First of all, if you play sports, you've got to get a physical. And when you go in for that physical, you're likely to be met with a new form and a push by your pediatrician due to this initiative, which is basically teaming up between sports organizations, including the National Olympic Committee and the American Academy of Pediatrics, to get more of these kids vaccinated. Up to 60 to 70% of kids participate in youth sports. So the administration thinks this is a pretty good way to try and reach them. The National PTA Association also pushing to have pediatricians come to those initial Parent-Teacher Association meetings for back to school to try and encourage parents to get more kids vaccinated. And then finally, more resources for pop-up clinics in these weeks before going back to school. There is such a small window now to get more of these kids vaccinated. And yet right now, that number for children ages 12 to 17 is only about 29% vaccinated. And we're already seeing, for instance, in states where you've got this confluence of children with high spread in their communities, people not using masks, low vaccination rates, children being hospitalized, for instance, in states like Arkansas. That is the concern here among officials, because there are a number of states down there in the southeast where they've got all three of these factors working against them. And guys, I've talked to a number of top epidemiologists who say it could be as little as 3 weeks before we see outbreaks in these schools.
Yeah, well, let's go to the southeast. Katie, it is the first day of school there in Atlanta, a city that does have a mask mandate. What will the start of the school year look like there?
Well, Joe, it varies depending on where you are. If you're in Metro Atlanta, you're going to have kids wearing masks as they go to school today. And as you stated, there is an indoor mask mandate within the city of Atlanta. But if you drive just 8 miles down the road into Cobb County, the masks are optional. Parents are able to choose whether or not to mask their children. So there are mixed messages when it comes to what local jurisdictions and what the state messaging is on this. As for Atlanta, they will be wearing masks going back to school today. We talked to the superintendent of Atlanta Public Schools. Here's what she had to say.
I think it's pretty clear where we stand. Short of mandating something that I don't have the power to mandate, we're communicating, we're explaining why, we're working with our parents. We know what we need to do. Unfortunately, as you know, it's become politicized in some places, and we want to remove that. Let's make this about kids.
That's where we are in Atlanta Public Schools. And it is unfortunate and a little frustrating that it's both political and complex. But when it comes down to the responsibility of ensuring, or at least trying to execute the best decision in the best interest of the diversity of our organization, when I say that, I'm thinking of our families, I'm thinking of our workforce, I'm especially thinking of our children, including those 12 and under who are not eligible for vaccination.
Now, the superintendent says between 58 and 59% of the staff inside these schools have gotten their vaccines, but she wants that number to be higher. She is encouraging more students and more staff to get the vaccines by actually offering vaccines within a lot of these schools. As for the governor of the state of Georgia, he has said he opposes mask mandates and does not support what's going on here in Atlanta.
All right. So, Heidi, we just saw a little bit there of your interview with Education Secretary Miguel Cardona. What is he hoping for with these new initiatives? Does he think they're actually going to work?
He does. He says that he is optimistic, but he's also clear-eyed about the challenges that they face. As you heard him refer there to the politicization of the issue here. It is ironic, he says, as well as other officials who I've talked to, that some of the same parents who were so upset about putting their kids into virtual schooling are now the ones who are fighting some of these protocols, some of the most basic protocols, including masking, which is the #1 thing that we know that you can do to keep your kids safe. And so he says he hopes that with this final push, that more parents will realize that this is not about the personal politics that they may hold. This is about the safety of their children.
All right, Heidi and Katie, thank you so much for your reporting this morning. Appreciate it.
Now in Missouri, first responders are scrambling to keep up with a surge in new COVID patients. NBC News correspondent Shaquille Brewster joins us now from Springfield, Missouri. Shaq, good morning. I know there in Springfield you spent the day with firefighters who are often the first to arrive and respond when a patient calls for help. What did you see while you were out with them? What did they tell you about this recent wave of new cases? I mean, how many calls were you responding to? Tell me about the day.
Yeah, Savannah, you really get a sense of how many people are impacted by the surges that we're seeing in these many communities. I mean, we often talk about hospitalizations and think of doctors and nurses, but it's firefighters who are usually the first people to encounter these patients before they officially become hospitalizations. So I want to show you a little bit of my time with the firefighters yesterday, and listen to what the fire chief told me, who last month he said we were about to witness a mass casualty event happening in slow motion. Well, listen to what he says now.
Our community is still in crisis. This is still what I'd consider a mass casualty event because we continue to be overwhelmed and inundated with sick and sicker patients than we've seen before. So the scale, if you look at the COVID spikes, that's what it feels like. It's like riding that initial uphill on a roller coaster, except this one we're not sure where it's going to break and drop us down the other side. Just treating these patients who are so sick. They're helpers. They want to fix problems. It's what we do. And a lot of these patients we can't fix.
This department says they average about 14 calls a day that involve possible COVID symptoms.
Now, Shaq, health officials say that where you are, Greene County, hospitalizations have increased by 54% in the last month. What are you learning about those hospitalized patients? I know that with this Delta variant, we're seeing different types of trends in who's hospitalized, who's getting extremely sick, who's dying. What are officials monitoring there in Greene County?
Well, they're saying that many of the patients are largely unvaccinated. As far as the average age of these patients, it may be younger than you think. It's 37 years old, and 93% of the patients that they see are unvaccinated. And then there was this one statistic that stuck out to me, that when a patient goes from just being hospitalized to ending up in the ICU, 51% of those patients who are COVID positive end up losing their life because of this virus. That does not include the people who are still fighting this virus in the ICU, but you're talking about more than half of those patients dying once they hit the ICU.
And Shaq, you mentioned mostly unvaccinated. How does Greene County compare to the rest of the country in terms of residents who've gotten the shot, and what's being done to get more people vaccinated there?
This is a point you hear not only from firefighters, but from doctors and nurses. The population, the unvaccinated population here, is much higher than the rest of the country. Just look at these statistics here. Here in Greene County, this is the county that holds Springfield, Missouri, only 42.6% of the population is fully vaccinated. If you compare that to the country at large, that's 58% fully vaccinated. You're hearing the push for folks to get vaccinated. I'll tell you, here at this firehouse and at firehouses across Springfield, they have opened up their firehouses to vaccination clinics. They know that they're trusted members of the community, so they're hoping that people come to them to get that vaccination. But it's clear that, at least at this point, not enough people are vaccinated to stop the surge that they've been experiencing for much of the past month. Savannah, Joe?
All right, Shaq, incredible reporting with that embedding there. Thank you so much.
Let's bring in Dr. Tina Carroll Scott. She's the medical director of the South Miami Children's Clinic. Dr. Carroll Scott, great to have you back on News Now. We appreciate it. You know, you've been focusing on vaccinating families who come to your clinic. I know you've been going into neighborhoods with pop-up clinics, and you really emphasize having trusted messengers who tell people they support the vaccine. Tell us more about that effort.
Yeah, so I work in an underserved area of Miami with primarily Black and Hispanic patients who have been disproportionately affected by this virus. And I have held 4 pop-up vaccine events in the last few months to address the access issues and the barriers preventing many of these residents from getting vaccinated. But unfortunately, there are still many people in this community who are distrustful and lack the proper education to make an informed decision about whether or not to take this vaccine. And to be honest, I think we're at a point right now in certain communities like where I work, where broad public health campaigns are probably not going to move the needle very much. I think it has to be organic grassroots efforts with one-on-one conversations with people to address their fears and concerns that they may have. People who have been fully vaccinated, talking to family, friends, neighbors, coworkers, et cetera, about their experience and essentially holding their hand to get them over that threshold to acceptance.
You know, many parents who have been vaccinated are worried about their kids who just aren't old enough yet to get the shot. What are some of the best ways to try and keep those kids safe, especially as school starts?
Yeah, I think my advice to parents with young children who aren't eligible to get vaccinated is that we have to remain vigilant with mask usage, social distancing, hand washing, all of the mitigation strategies that we've been using for the last year and a half. And parents need to model the behavior that they want to see in their kids. And the kids will follow. I know that we all have COVID fatigue, but we cannot let up until our children are fully protected. And although it is true, or has been true up until this point, that children have largely escaped the severe disease and death seen with adults. This Delta variant, which is much more highly transmissible, is causing many more hospitalizations with unvaccinated children. And we truly don't know what the long-term effects of this virus will be on our kids. So we have to do everything in our power to protect them.
And Dr. Carol Scott, we just heard from Shaq about the challenging situation in Missouri. To the south in Mississippi, one hospital only has 6 ICU beds available. Another in Arkansas only has 25 beds available. These are numbers we saw at the height of the pandemic last year. How bad do you fear this is going to get, and what is going to happen in these overwhelmed hospitals?
Yeah, that's the biggest fear of everyone in healthcare right now. And the surge that we're seeing in our hospitals across the U.S., especially in the South, it's not sustainable long term. Our hospitals are stretched to capacity with limited resources and manpower. And the mental and physical toll that it's taken on physicians and other healthcare workers is indescribable. I think that many people forget that that although COVID is taking up most of the airtime right now, there are still people having heart attacks and motor vehicle accidents that require medical attention in a hospital setting. So when our hospitals are strained with taking care of COVID patients, you may not get the level of care that you want or deserve because there aren't enough resources available. So that is why getting vaccinated is so critically important. It's really the only way out of this pandemic.
We know you and so many of your colleagues thought you were through the worst of it. Now you're seeing this. We really appreciate everything you're doing, and thank you for taking a few moments to speak with us about this. Take care.
Thank you.
Now to the latest fallout for New York Governor Andrew Cuomo. A growing number of lawmakers say there are only 2 options for the governor: resign or be removed from office. This, of course, all comes after that scathing report by the state's attorney general detailing accusations of harassment by nearly a dozen women. And now, amid mounting pressure, 3 more district attorneys across New York begin their own inquiries into the allegations and join the Albany County DA in asking for evidence from the AG's report. Let's get the latest now from NBC News correspondent Gabe Gutierrez, who is in Albany, and NBC News correspondent for investigations, Tom Winter. Good morning to both of you. Thank you for being here. Gabe, I will begin with you. So the last time we heard from Governor Cuomo was Tuesday, when he once again denied touching anyone inappropriately or making any inappropriate sexual advances. But since then, we've heard from a long list of lawmakers calling on the governor to step down. That list includes the president, of course, but also the top Democrat in the New York State Senate, who told you that the only other option would be impeachment. Obviously, all of these options ending with the governor out of office. Tell us more about your conversation.
Oh, good morning, Savannah. You're right. Governor Cuomo has very few friends left here in Albany. The the Assembly Judiciary Committee is set to meet on Monday to discuss next steps in this inquiry. But Savannah, as you mentioned, it's a very tall order for the governor to survive this politically. More and more lawmakers are saying they will vote to impeach. According to a tally from the Associated Press, 86 Assembly lawmakers have already said that they vote for impeachment. That is more than the majority needed to impeach Governor Cuomo and then send this case to the state Senate, where he would face a trial. I spoke with the top Democrat in the state Senate yesterday, and as you said, she says if he doesn't resign, he will likely be impeached. Take a listen to what she had to say.
I believe that most of the legislature at this point is willing to just move forward so that we can do what we have to do and regain our focus on the things that are important to New Yorkers.
So, Savannah, this whole process could take at least a month, potentially several. Again, it would start in the Assembly. Once they vote to impeach, it would then move to the state Senate. Governor Cuomo would temporarily be stripped of his powers while that trial plays out. Again, it could take several months. And, Savannah, it has not happened here in the state of New York, a removal from office like this in more than a century.
Yeah, let's continue on this, on how that would happen and what that process would look like. Tom, let's bring you in here. It's important to note that Governor Cuomo has not been charged, but there are now more inquiries into his alleged behavior stemming from the AG's report. So what is the latest there? Where do we stand with all these inquiries and investigations?
Well, good morning, Savannah. We'll do this geographically and go from north to south, starting with the State House and where that is in Albany. So the Albany District Attorney's Office has an ongoing criminal inquiry into some of the allegations that were raised in that report produced by the Attorney General earlier this week, as you referred to. Moving south from there in Westchester County, that's where the governor used to live in Mount Kisco with his former girlfriend. There are allegations specifically pertaining to that New York State trooper who he allegedly harassed, as well as touched inappropriately, kissed at one point. A lot of that type of activity that's referred to there in the report started in 2019 in Mount Kisco, so that's in Westchester County, and Mimi Rocha is going to take a look into that there. She's the DA. Further south, the Manhattan District Attorney Cy Vance, who we've often spoken about in connection with investigations into the former president. His office has asked for investigative materials to see if there's anything there that they need to look into. And then in Nassau County as well, they're doing the same thing. Basically, all four offices reaching out to the Attorney General and saying, look, we know you have investigative material. Can we look at it? Can we see if there's any violation of criminal law here? And then we'll proceed from there, Savannah.
Tom, the most organized way to go through this as we keep learning more and more. Thank you for the map. All right, Gabe, tell us what's next here. What's a timeline on impeachment, or how soon could we know if criminal charges would be filed?
Well, and that is a big question. There is no clear timeline on impeachment, but as I mentioned briefly before, there is a pre-planned meeting of the Judiciary Committee here in Albany on Monday to potentially discuss next steps. The Assembly Speaker has already said that he wants this process to be expedited because Governor Cuomo has lost the confidence of the Democratic majority. His statement came out earlier this week on Tuesday, shortly after the report became public. So the feeling here in Albany is that this will happen on a faster track. But Savannah, as I said, this is a process that has not happened in really more than a century, and it could take potentially a while. Governor Cuomo, if this were to move to the Senate, if he were going to trial, he'd have the opportunity to defend himself. There will be witnesses called, so it could potentially take months, Savannah.
And this is all coming as one of the governor's accusers, Lindsey Boylan's lawyer, says that that client plans to file a lawsuit. Tom and Gabe, thank you so much.
Time for a check on your morning news now. Weather
with Janessa Webb. Good morning, Janessa.
Good morning, Savannah and Joe. You know, we started off the week so well, but we are taking kind of a left turn. NOAA has released a new outlook for hurricane season, and normally we see that peak of hurricane season September 10th. But look at this new outlook that was just released yesterday, 65% above average for hurricanes this season. And this is the sixth consecutive year that we're going to be dealing with early hurricanes. Now, forecasts right now, they're predicting 15 to 21 named storms. That includes the 5 storms that we've already seen so far. But major hurricanes, that's what we're really taking a good look at. 3 to 5 now forecast for the 2021 season. So we're also watching a system that's already starting to pick up across the African coast. It's starting to become more well organized. National Hurricane Center forecasting the next 5 days there is a 40% chance of development. So we're going to be watching that system pretty closely. Things will start to rev up, so we're asking people really now to start getting prepared. Fire season, it's already big time across the Pacific Northwest. Winds picking up today across Oregon into Washington State up to 40 miles per hour. It's time to prepare, guys.
Yeah. Oof. All right. That's not good news. Janessa, thank you so much. We'll see you in a bit.